Welcome to another episode of Jay Helps the VA. In this episode, we're going to discuss again CHAMPVA. This will be part 6. We're going to be talking about provider claims. So, provider claims, this is because they need some guidance sometimes. So, sometimes this video is to help the patient or beneficiary that's got the CHAMPVA and trying to figure out how to get their claim across the finish line, and they need to give guidance to the provider. So this is A for the provider, or it's B for the beneficiary trying to give guidance to the provider that doesn't know what CHAMPVA is or how to submit the claim. So just we'll make it real easy, real digestible, and real to the point. So Jay helps the VA, serving those who serve their spouses, caregivers, children, and providers. So we're trying to help everybody here, not just singling out one side of the story here. We're trying to help everybody. So in today's episode, again, provider claims. So provider claims, they must be submitted to CHAMPVA within 1 year from the date of service. Okay. Now, if the beneficiary or patient, okay, has a primary insurance, so say there's a Blue Cross and then there's CHAMPVA, okay. So if there's a primary like a Blue Cross, then the claim is going to have to be submitted to that primary. So once the primary pays, okay, so 1 year from the date of service, the provider has 1 year from the date of service to submit the claim to that insurance. So that would be Blue Cross or Kaiser or Cigna, whoever it is. After that insurance is paid, then the claim has to be submitted to CHAMPVA. So 1 year from the date of service to get the claim to the primary insurance. After that primary insurance pays, then they have 90 days, they have 3 months, 90 days to get that claim to CHAMPVA, or they don't get paid. It's called the timely filing rule. Okay, so that timely filing rule is 365 from the date of service, and it's 90 days or 3 months after a primary is paid. So that's the timely filing rule. That's how that works. Now, when these claims are being submitted to CHAMPVA, they do require supporting documentation. So we'll just go over the nuts and bolts, whether it's the provider or the beneficiary, whoever is listening at my messages here or my episodes. So a provider is going to have to, they're already going to know what I'm talking about, but I just cover the nuts and bolts for both parties. So a provider must submit a claim. They have 3 different types of forms. So if they're a doctor or a specialist, they're using a certified Medicare billing form called a CMS-1500. C is in cat, M is in Mary, S is in Sam, -1500. So that's a doctor or a specialist. If it's a hospital or medical regional medical center, then they're going to be using a UB, U as an umbrella, B as in boy, -04. So UB04, or an acronym called HCPCS. It's an acronym. I have no idea what it stands for. H is in helicopter, C is in cat, P is in Papa, C is in cat, S is in Sam. Again, providers are going to know what these are. That's their standard Medicare billing form. They obviously know they have to submit that in order to get the claim to a primary, or if they're B, submitting directly to CHAMPVA. So, aside from the certified Medicare billing forms that are necessary, providers that have identified that the claim has got a primary, then obviously they have to submit it with the supporting documentation. Just on the bare bones minimum, they're going to be submitting the EOB, or explanation of benefits, from whoever it is. So if it's Kaiser, it's Kaiser's sort of or explanation of benefits. If it's Cigna, it's Cigna, and Medicare. So there's a thing about what's called a crossover. Now, crossover, people that are astute of Medicare, and if they're dealing with a CHAMPVA beneficiary where Medicare is the primary, they're going to submit the claim to Medicare electronically. Because both CHAMPVA and Medicare are both federal entitlements, the claim has the ability to cross over. Keywords ability, not guarantee. So they submit the claim to Medicare, and that patient has a Medicare primary. The claim has the ability to cross over to CHAMPVA electronically and take with it the Medicare EOB, or explanation of benefits. These crossovers don't always happen, ladies and gentlemen. So, how do we know whether they did or not? Well, we don't know unless we call. So, that is my number one strongest emphasis for every provider who's submitting a claims. Don't fire and forget. Find out if your claim was received. Don't wait. Now, the number is 1 800 733 8387. 1 800 733 8387. There's a provider side, beneficiary side, doesn't matter. They're answering the calls, and yes, sometimes the wait is long. Irregardless, you have to verify things are being received, or how do you know it was received? You're not telepathic, are you? So, I don't mean to be a comedian on here, but a little follow through and common sense and due diligence does not happen out there. How do I know? Because I can speak to it on an everyday basis. So it doesn't take place. So what has to take place is following up. You reach out to CHAMPVA, you ask them, what they're going to do is your claim came in the door and it had said supporting documentation, then it's going to have a document number. Okay, so that document number will be furnished and a date that the claim came in the door. If that claim came in the door one day, the input date of that claim is a different day. So that turnaround time will be advanced. Now, once that claim has come up in its pecking order, it stops being a document number and then it has a claim number. Once it has a claim number, the claim has 30 to 45 days to finish processing. So it's this whole come in the door, wait in line as a document number, then it becomes a claim number, then the claim gets satisfied in that order. And it must also have, if there's a primary, that EOB or supporting documentation. Must follow this formula for success. So I know it's a pain in the neck to call CHAMPVA or Medicare or any other giant monstrosity because the long time on the wait to get your answers. But the truly only way you can vet something was received and get that doc number and get a turnaround time is to call. So I reinforce that. There's two different ways they can submit claims, providers that is. They can submit it electronically or by paper, okay? So the old-fashioned way, I'm going to give you the address. So CHAMPVA initial claims, line number 1. Line number 2, P.O. Box 46964. Line number 3, Denver, Colorado 80246 9064. So that's how you submit the claim by paper. That's if you're not technologically inclined. If you are electronically, collaborating as it were, use a clearinghouse is what it's called, and you submit the claim electronically. Use that clearinghouse, you're going to use a payer ID. CHAMPVA's payer ID is 84146. 84146. 5 numbers, that's it. So, very simple progression, submitting the claims. A lot of people make it out to be more hard than it has to be. Don't know what CHAMPVA is. It's federal entitlement. It's been around for decades. It's called purchase care, okay, under the community care umbrella for the Veterans Health Administration. Purchase care means what? The past. Money was allocated in the past to pay for claims. So the money's there, why would they not pay? So it's all about vetting. Something was received. When it's received, we give document numbers. Once you have a document number, then you have a claim number within a certain time after that progression, then you know your claim is going to be satisfied. So if you follow this recipe for success, you can, ensure your claims are being received and that you're getting some sort of, something to sink a hook into. How many how many days, how many weeks do I got left till the claim is going to be satisfied? Okay. As always with these claims, there's other parts or components of it. So there's going to be 2 more topics I guess I'm going to have to cover here because the CHAMPVA is an ever evolving topic. I haven't completed all of the information. There's more to go. So we'll be talking about resubmissions. We'll be talking about appeals. We'll be talking about helpless child. We'll talk about caregiver. A bunch of different topics are still coming, folks. We're going to keep going until I run out of ammunition. So that's my mission. Jay helps the VA. I'm Jay, serving those who served, their spouses, their caregivers, their children, their providers, whoever needs that, somebody to connect the dots for the program. So as always in every video, I like to point out Team River Runner behind me. That's what those little stickers are. Team River Runner is helping veterans on the river to recovery. It's all about water sports, helping out veterans get, might have atrophied limbs, service-connected disabilities, you know, other disabilities. It's PTSD. It's all about helping vets get into water sports, connecting with other vets, developing camaraderie, getting exercise, getting out of the house. So I support them. I try to give them this push every episode because they need it, and that's part of my giving every month. So please support them, spread the word. There's 60 chapters in 50 states. So I'm Jang. I'm signing off for now. You like what I'm doing? Like it, subscribe it, share it with other vets, their wives, their kids, everybody. More stuff's coming. Got a lot of stuff coming. It's just planning it and coordinating it and getting the time to getting it out there. So happy New Year to all of America here from Jay Helps the VA. We'll be here next week delivering another wonderful episode. It's more than likely going to be about resubmissions for claims or appeals or both. I'm not quite sure how much information we're going to parse out, but other topics will follow after that. All right, good folks. So once again, check me out once a week. A one man show here. So reach out to me if you can. I always leave email link if you're trying to get questions to answers or problem solved. I try to address those. If the topic's big enough, I might create an episode about it. All right. Well, you good folks have a great night. Once again, Jay Helps the VA. Check you next time. Thanks again. God bless America. Well, God bless all the veterans, and take care.